Childhood vaccines are extremely important. They have been proven to be 90 to 99% effective in preventing disease. Vaccines are essential in not only protecting the recipient, but also is essential in stopping the spread of contagious disease and protecting those around you. Vaccines are also more cost-effective in the long run. By preventing diseases and illnesses, it can save parents from the burden of many medical visits or expensive medications. We will present the impact of vaccines on various diseases as well as the vaccine specifications and discuss the vaccine correlation with the development of mental disabilities. According to vaccines.org, vaccines produce immunity 90 to 100% of the time, and all vaccines must be approved and licensed by the FDA in order to ensure safety and effectiveness. Looking at all graphs of disease popularity, they decrease substantially starting in the years that the vaccine was invented or licensed. Vaccines for children from birth to age 6 successfully prevent chickenpox, diphtheria, Hep A, Hep B, the flu, HIV, measles, mumps, polio, pneumococcal pneumonia, rotavirus, rubella, tetanus, and whooping cough. There is no federal law requiring vaccinations, but all 50 states require certain vaccinations before enrolling in public school. These regulations are in place to decrease the spread of diseases and sickness. Adverse reactions are very rare. For example, in the smallpox vaccine, for every 1,000,000 people vaccinated against smallpox, between 14 and 52 may have a life-threatening reaction, which is much less than 1% of the people. Adverse reactions are often caused by preservatives, not the vaccine itself. The reactions include rash, redness, and swelling only lasting a few days and are just on the surface. In younger children, fevers are more common as their new immune systems are just learning to fight off infections. Mental disabilities are a correlation between vaccines, not causation. Mental disabilities such as autism and Down syndrome exist on a spectrum. Since the 1980s, the spectrum has expanded, leading more people to be diagnosed with mental illnesses. Because of this increased knowledge about these mental illnesses and disorders and the expanding spectrum, those that are diagnosed today most likely wouldn't have been diagnosed in the past. This difference creates discontinuities in data, which means it cannot be studied in relation to potential causes or other reasons. Also, both autism and Down syndrome are genetic diseases, and vaccines do not affect genetic code. Vaccines are extensively tested and researched by the FDA before they are released for us. While patients may have an unexpected allergic reaction following a vaccination, medical professionals are well trained in dealing with allergic reactions. In conclusion, vaccines are among one of the most influential healthcare inventions in the 20th century and have made a dramatic reduction of life-threatening disease among children. Vaccines are an important part of healthcare.